Hello, my name is Jagadish Munagapati, and I'm a junior at South Forsyth High School. And today, I'd like to demonstrate my project on an AI-powered visual medical tool in diagnosing cardiovascular disease. So, how did I first think about this project? Well, I got inspiration from Northside Hospital, where I conducted my volunteer experience in observing cardiovascular disease patients undergoing a treatment process. While looking at this treatment process, I realized that it could have been streamlined or entirely avoided if we had in fact identified this disease earlier on. And so I began devising a method to achieve this. Doing some prior research, I realized that there were test scores such as RCRI and STS, which gave the cardiac arrest risk rate for pre and post surgery. As well as this, there was also the atherosclerotic cardiovascular disease risk estimator, which provided the 10-year predictive risk rate for contracting cardiovascular disease if given some numerical data. But if we were able to input more data, maybe we would be able to boost its accuracy rate by a significant margin. So I decided to use image data and train an AI model on it, since AI had made large leaps in recent times. But gathering this image data proved to be a harder challenge than was necessary. Certain protection laws, such as HIPAA, had completely barred patient history from online public access, and so I had to find a way to circumvent this. I realized that I can in fact use facial characteristics that had already been proven to be correlated with cardiovascular disease and use an AI image generator in order to generate this image data. After generating all this image data, I created 3 separate models to specialize in identifying each characteristic and trained these each on a separate data set for 3 separate data sets of 1,400 images each. As well as this, I integrated with it with numerical data provided by the ASCVD, the RSARI, and the STS scores in order to provide a full integrated model. After this model, these preconceived test scores had previously had a sensitivity and specificity rates of 80% to 90%, which indicated its ability to discriminate between a patient with CVD or without CVD. However, my model was able to surpass the 90% threshold and gain an accuracy rate of almost 93%. But what does this really mean for us? Well, aside from my model being able to discriminate between a patient with and without CVD to an accuracy rate of 93%, it really pinpoints a severe problem in medicine today. Rural environments have extremely limited access to healthcare and different facilities, and my model is able to combat this to a high extent since it's able to provide high accessibility and accuracy simultaneously.